I'm very sad to report the death this morning of a patient with COVID-19 at Middlemore Hospital. Further details will be available later today after discussions with their family. But on behalf of all New Zealanders, I'd like to recognise this family's loss and offer our deep sympathy. Turning to today's new cases, there are 39 new cases in the community to report. 30 of these cases are in the Auckland region and 9 are in the Waikato. That brings the total number of cases in the Waikato to 18. There are also 2 cases to report in recent returnees in our managed isolation facilities and 1 further case in a border worker which remains under investigation. The whole genome sequencing is underway to determine whether that case is linked to the border or whether it will be classified as part of the community. Of today's 39 cases, only 1 is yet to be linked to a current case, and interviews into this case are ongoing. And also an update from yesterday's cases, there are 4 which remain unlinked from the ones that were reported yesterday. We have 12 active subclusters where there have been recent cases, and they still remain the focus of our public health response. So looking ahead, we estimate from the number of already notified contacts that there could be an additional 36 cases in coming days amongst known household contacts. For hospitalisations, there are 32 people in hospital with COVID-19, 7 of which are in ICU or a high dependency ward. Of the 18 cases in total in Waikato, of which we're reporting 9 new ones today, we know that they are all linked to known cases, either as household contacts or socially. 2 of these new cases reside outside the Alert Level 3 boundary in place, and that's at Kawhia and Karapiro. Auckland DHB are setting up a pop-up testing centre at Karapiro. There are 5 pop-up testing sites operating in Hamilton, Raglan, Huntly and Tokoroa today, with all 5 being open for extended hours to cater to any expected lift in demand. An existing site at Founders Theatre car park in Hamilton remains open. Waikato DHB have also informed us that a patient visited its emergency department last Friday night between 10:30 p.m. and 1:55 a.m. That person has now tested positive for COVID-19. The patient was asymptomatic on arrival at ED, was screened by staff who were following Alert Level 2 infection prevention and control protocols. Despite adhering to these protocols, out of an abundance of caution, the DHB has temporarily stood down a number of ED staff who are self-isolating, undergoing rapid testing with results expected later today. Some of these staff were working in a different part of the ED to the case, but are still being tested as a precaution. And finally, in light of the increased risk from the current Delta outbreak, the Ministry of Health is advising New Zealanders to consider a shorter gap between the 2 doses of the Pfizer vaccine than the current standard of 6 weeks. That's because we need to protect ourselves, our whānau and our communities. We need as many people as possible to have their first dose to be partially protected, but we also need all those people to be fully vaccinated with 2 doses as soon as possible. In August, we extended the standard gap between the first and second doses of Pfizer vaccine from 3 weeks to 6 weeks to allow us to give 1 dose to a larger number of people faster. But now, by enabling people to have that second dose sooner, but after at least 3 weeks, more people can be fully vaccinated sooner and hence increase our community immunity.
Clearly, cases outside of the boundary are a stark reminder of how tricky the virus can be to manage and, of course, how dangerous it can also be. We're seeing COVID-19 tracking down unvaccinated people and it's making them sick. Our goal is to get the vaccine to people before COVID-19 finds them. We've now fully vaccinated half of the eligible New Zealand population, and in Auckland, around 85% of people have received at least 1 dose of the Pfizer vaccine. Yesterday, 63,624 people received a dose of the vaccine, the majority of those being second doses. Because we're an innately competitive country, it's worth noting that the North Island and the South Island are now neck and neck in the race to be the most vaccinated island, both islands sitting at precisely 80% of their eligible population having received a first dose. This week, a 30-strong team's been set up to support disabled people to access transport and to get vaccinated in a way that suits their needs. It's another piece of our plan towards continual improvement to make the vaccine accessible to everyone. So to speak with support specialists, people can call the COVID-19 vaccination healthline on 0800 28 29 26. It's free. That's from 8 a.m. to 8 p.m. Monday to Friday. If they press 2, they'll speak to the right team. Getting back to 0 cases of COVID-19 in the community is now unlikely. We need to prepare for a gradual transition to the next phase of our COVID-19 response. New Zealanders have consistently shown over the last year that they're willing to pitch in as part of the team of 5 million and help us confront the challenge of COVID-19 head on. We need to channel that energy into a final big push to get New Zealanders vaccinated. We have within our reach another significant COVID-19 milestone. We can be one of the most highly vaccinated countries in the world, but to get there we will need a big collective effort. We all have a role to play in getting our vaccination rates up. So my message to the 80% of the eligible population across New Zealand who have had their first dose is this: your job is not yet done. You still need to make sure you get your second dose, but you also need to help us reach those who have not yet been vaccinated. You need to help us get them comfortable with being vaccinated. So we want you to talk to them about the reasons that you have chosen to be vaccinated. We want you to help make sure they get reliable, honest information about the vaccine. And we want you to help deal with any logistical barriers that may have stopped them being vaccinated. The next week and a half is critical. We want to pull out all of the stops to increase our vaccination rates. It has never been more urgent. So we're asking everyone to contribute to a big nationwide push for vaccination. This will culminate in a National Day of Action for Vaccination on Saturday, the 16th of October, Super Saturday. On that day, we'll have vaccine clinics open throughout Aotearoa all day and into the evening. And a bit like on Election Day, we'll be asking all of our civic and political leaders to contribute to a big effort to turn people out. We currently have 350,000 appointments available on Book My Vaccine over the next 10 days, and that doesn't include vaccinations available through many of our general practice sites, where around 20% of New Zealanders have been getting their vaccines. We're working to increase that capacity even further, but what we need now is demand. Tomorrow we'll be releasing maps that show where the highest concentrations of unvaccinated people are by suburb. This will be helping our local iwi who've been pushing for this, our local communities and our local MPs to work together to mobilise their communities. Whether that's going door to door, working the phones, waving signs, there will be a role for everybody to play here. Our political parties have different views on aspects of the COVID-19 response, but we are all united in one thing: vaccination. So Super Saturday will be an opportunity for all of us to put aside our political differences just for 24 hours and work together for a cause that we all support. A webpage will be going live this afternoon with key information about the day and how people can get involved in it. We're also asking our business community, our media, and our community groups to play a role in this as well. Those that want to offer incentives to the unvaccinated to get them through the door are encouraged to do that. We'll be asking parents and grandparents to encourage young New Zealanders to take up the opportunity to be vaccinated. We want to leave no stone unturned. No one should be left behind because they haven't had the support that they need to make an informed choice about vaccination. Our response as a nation to the challenges posed by COVID-19 has been world-leading, and now we need a world-leading uptake of vaccination. So my request to everybody is this: let's pitch in and let's get this done.